Good morning to everyone. Today, we are going to discuss about the PSM MRB based recall session questions for the recent session. So, based on the recall, we are going to discuss the questions. So, first going into the first question. According to biomedical waste management rules, the contaminated waste or infectious plastic waste is disposed in which color paper? So, you see, plastics. So if you hear the word plastics, it can be contaminated or infectious until there is some catch. Always plastics, they will go into red color. So until there is a catch, plastics will go into red color. So what could be the catch? See, there is something called microbiology or biotechnology waste. So like culture medium. So this is the culture plate. We are growing some bacteria. This bacteria could be grown in a culture plate. In this culture plate, we are growing some microbiology waste. So this, if they have specifically mentioned, there is a plastic culture plate on which we are growing a microbiological organism, then you can think of yellow. But here, there was no mention about anything, just contaminated or infectious plastic waste. So for this question, the straight answer is red. The straight answer is red. So this we saw in our MRB workbook, volume 1, page 187. In our volume 1 of the MRB workbook, we got this beautiful picture. Yellow color for human anatomical, animal anatomical, soil waste, expired medicine, discarded medicine, chemical waste, discarded linen, mattress, beddings which are contaminated with our blood, the body fluids, and our routine mask, gown, microbiology waste, biotechnology waste, even blood bags. Then they go into the yellow color bag. Then for chemicals, we should have a separate collection system. So what is in red color? In red color, you have to include the IV tubes, intravenous tubes. See, you are treating a patient, you have an IV bottle. From this bottle, you have an intravenous tube. Then if you are putting some injection to the patient, this needle will go into white. Except the needle, all these plastic syringes and everything will go into red. Even the gloves, rails, tube, urinary catheter, vents on, everything will go into red. Mainly for plastics. Contaminated waste, recyclable, mainly plastics. Plastics, mainly it is for plastics. Next question, second question. It was straightforward, the incubation period of chicken poxes. So normally the incubation period of chicken pox, it is around, we can remember it is around 2 weeks. On an average, it is around 14 to 16 days. But it can range between 10 to 21 days. So out of this, 14 to 16 is nearer to 10 to 21. So this was our best option. This was seen in our MRB workbook, volume 1, page 182. In communicable diseases, we discussed about chickenpox with all these diagrams showing the differences between the smallpox as well as chickenpox, as well as we have diagrams of the monkeypox. We had so many things. So this is the incubation period, 14 to 16 weeks. 14 to 16 weeks. So it could be even written as 10 to 21 days. So next question. The diagrammatic representation, which is obtained by joining the midpoints of the histogram block. What is a histogram? So histogram, so we are taking continuous variable height. Height is a continuous variable. We are taking 4 or 5 actors. See, 3 actors are having the height between 180 to 185. 2 actors are having height between 185 to 90. And 4 actors are having the height between 190 to 200. What they are telling, this is called as a histogram. There is no gap between the bars. So it is called as a histogram. When we join the midpoints of the histogram, what do we get? We get something called as the frequency polygon. This is also a direct question from our MRB workbook, volume 1, page 167. You see, frequency polygon. So in the bar charts, there will be a gap between the bars. But in the histogram, no gap between the bars. We are joining the midpoints of the histogram. When we join the midpoints of the histogram, we get the frequency polygon. Next question. In India, the births should be registered within. The easy question, direct from our MRB workbook. Births and deaths both should be registered within 21 days. So MRB workbook, volume 1, page 100. 75. So this is also direct from our workbook. See here, we have discussed during the MRB class, births and deaths registered in 21 days. Births and deaths registered in 21 days. According to our Registration Act, we have to register the births and deaths within 21 days. So this question, you can also see it in our MRB leaderboard, MRB final leaderboard, day 2, question number 7. So this was also discussing about the registration of births and deaths. Next question. What are the vaccines contraindicated during pregnancy? One of the following is not a vaccine which is contraindicated during pregnancy. So generally, pregnancy, immunocompromised state, our immunity is low. So what we will not give? Live vaccines, contraindicated. So you have to look for the live vaccines. So these are all live. So which is not alive? Rabies is not alive. So this is not contraindicated. This was also given from our MRB practice paper. MRB practice paper 7, question number 99. We had this. See, live vaccines are contraindicated during pregnancy because hepatitis B is an inactivated vaccine. It is safe. So all the live vaccines, including measles, rubella, and BCG, are contraindicated in pregnancy. Next question. So we also had the same question in our MRB leaderboard, question number 26. The same content. Next. Which bacterium is commonly associated with food poisoning from improperly cooked meat? So it's actually Salmonella typhimurium. So Salmonella typhimurium. So Salmonella typhimurium. So this mainly concerned with food poisoning from the improperly cooked meat. See, we discussed this, everything we discussed for Salmonella typhimurium. We see in the MRB workbook, volume 1, page 183. See, Salmonella mainly comes from the farm animals, poultry. So what they do? Mainly, they get contaminated from the animals' urine and the feces. They may get contaminated. They may contaminate the eggs. They may contaminate the meat. So when we take it, we get this food. So name Salmonella typhimurium. So in Staphylococcus, it is mainly due to a heat stable Staphylococcus aureus. Next question. All the following vaccines are sensitive to freezing except. So one of the following vaccine, see, all the following vaccines are sensitive to freezing except. So you have to choose one among the following which is not affected by sub-zero temperature. So one among the following which is not affected by sub-zero temperature. You have to choose one among the following which is not affected by the sub-zero temperature. If you see, everything is affected. Sorry, PV, DT, hepatitis B. All the vaccines, especially with the letter T, you can remember T, PT, DT, TD. So anything with T, mostly hepatitis B. So these vaccines will be affected by freezing. Other than this, even HPV, Haemophilus influenza type B, they will also be affected by the freezing temperatures, even rotavirus. If you see Japanese encephalitis, it is not affected by the sub-zero temperatures. This you can see by the MRB workbook volume 1, page 180, where you can see this picture. Is there in this picture? So if you see in this picture, the lower ground, the lower places we have OPV, BCG, and measles. So we have this. There is no problem if they come in contact with the floor because they can be even kept in frozen temperatures. Above that, we had JE. Above this only, we had all other vaccines. They should never come in contact with the lower container or in the walls. So the freeze sensitive are all these diphtheria, pertussis, tetanus, hepatitis B, and HIV, including EP, even PC. Next, a rabies-free area, it is defined as one. When will you define an area as a rabies-free? See this, there are some doubts in this question, whether it is 2 years or 3 years. Now see, for this question, rabies-free area means it is an area in which there is no case of indigenously acquired rabies. That is, without any importation from outside of the country, if there is no case of rabies in mans or also animals for 2 years, it is enough. So generally for other diseases, you see when we will tell eradicated and all, so eradication usually for many diseases you have seen, it is for 3 years eradication. But for here rabies free, it is only 2 years. So here only you have to be more careful. For rabies free, it is only 2 years. Here only you have to be more careful. Why I will tell you. Yes. See, this is the WHO expert consultation on rabies, the third report in 2018. According to these guidelines, you can see here the countries that are free of dog rabies. There is no rabies in humans, dogs, or any animal species for the past 2 years. This is the WHO report. The guideline, it tells there is no rabies. Not in humans also, animals also. For at least 2 months. For at least 2 weeks. So this is the guideline released recently, 2024. Our government of India. You can see here what is the criteria for declaring a city as rabies free. In this criteria, they told this 3 years is for only 0 reported human deaths for 3 years. See, no case. This is no case for 2 years. The country can be told as free of dog rabies. Then no deaths for 3 years. No deaths for 3 years. But you can see in the question. What is the question about? A rabies-free area. No case. They are only talking about case. So case means no case of indigenous. That is within the country. There is no case for 2 years. And recently, according to India, we are dividing the cities as rabies-free. Which city is rabies-free? In order to tell that, the government of India has given some guidance, that is no death of human for 3 consecutive years. So you have to be careful with this. So many would have chosen 3. Why they would have chosen 3 years? Because generally in the term eradication, whenever a country has no disease or anything for 3 years, we cannot even find the microorganism in sewage also, animal also, human also for 3 years. Then only we tell it as eradicated. It is usually for 3 years. So we discussed in the class about eradication, elimination, and control, but we could not go about how many years specifically. But we discussed about the general criteria or definition of eradication, elimination, and control. Case detection of sexually transmitted diseases is done using all the following methods except. See, STD, for identifying or case detection of the STD, we use usually 3 methods we are using. So we are using 3 methods. So first one is screening. All the high-risk patients we are screening. Any high-risk groups, IV drug users, we are screening. Then even we are screening in the blood bag, we are screening. Then we are screening all the A and C. So groups we are screening. Second one is called contact tracing. What is contact tracing? Yes, we are tracing the partner. For example, your partner is having HIV. Then the partner of the X also we will check it for HIV. We are checking the partners. That is contact tracing. Next one is called cluster testing. So what is cluster testing is along the same group. There are a group of IV drug users. They live in the same environment. They are a group of 10 people. Like we have seen cinema, we are a group of 10 people. We do not know what is fear. Like this, there will be a group like this among the groups, among their environment. We are testing. who are all having, we are testing among their environment. So in the social environment, we are testing who are all. So these are the three ways: screening, contact tracing, cluster testing. It is easy because notification will not come. So notification, it is like mainly for legal issues like TB is a notifiable disease, occupational disease are notifiable disease. There's like mainly it is like a legal thing, notification. This, although we could not discuss about everything, we discussed about the syndromic approach of the STD and the STD kits. So what is the substance added to the vaccines to increase their efficacy? So what are the substance added? So there is a vaccine, it has some antigen. So if you give the antigen to the body, it may reject a go. But when we use the antigen with something like adjuvant, usually of aluminum or aluminum hydroxide, the body will take, wow, it is good, I will take it. So this is the adjuvant, it will increase. So if you have only 30% response, after adding the adjuvant, we may get 75% response. Response can increase. By adding one song in the film, we can increase the collection of the film like this adjuvant. It's called adjuvant. So this, it is clearly from our MRB, we had discussed this in the MRB PSM question 9. So subject-wise questions, the subject-wise questions, it is there, it was discussed in the answer-based explanation, high points, both the adjuvant. They enhance the body's immune response to the child. So next, which of the following is not seen in lead poisoning? See, lead poisoning, the effects can be organic as well as inorganic. Poisoning, the effects they can be organic and inorganic. Then if they cause the blood-brain barrier, they may cause delirium, confusion, everything. But inorganic clearly mainly lead to anemia, basophilic stiffening of the RBCs, Burtonian line, mainly in the gums. We have the teeth, in the mouth we have the teeth, there we have the gums, the Burtonian lines, then the nerves, peripheral neuropathies, wrist drop, foot drop. So only thing is Mees lines will come. So Mees lines it will come. So see, that is from our MRB, question paper 8, question number 21. So in MRB, we had practice papers, then subject-wise papers, then MRB, then we also had a leaderboard, then the main thing, workbook with description. So which four contents we are seeing? See, organic lip, so gums, blue line, wrist drop, foot drop. So almost this is directly from this material. Next, what is the first line antiretroviral therapy regimen? So this is told. Someone told you about me. Someone told about the ART regimen. Told. So told. So tenofovir, lamivudine, and dolutegravir. So it was a question we can relate it from our MRB, OBG subject-wise, question number 6. We can relate it. So we can relate that. So efavirenz, the one that is not being used nowadays, mainly tenofovir, lamivudine, and dolutegravir. Next, under the ICDS scheme, the supplementary nutrition program aims to provide what percentage of RDA for calorie and protein for the preschool children, the children before going to the school. So what is the calorie and protein given? So mainly it is from children between 0 to 6 years of age. So in this, the nutrition is mainly given from children between 6 months to 72 months, 6 months to 6 years of age. How much? So in their daily food, how much they should take from their daily food? So how much it should come? For example, if their daily food calorie requirement is 1500 kilocalories and their protein requirement is around 30 grams, it should give about 1/3 of the calories and half of the protein. For example, we can take a child of around 16 kg or then it may require around 1500 kilocalories, around 30 grams of protein it may require. So in this half of the protein and 1/3 of the calorie, it should come from this ICDS supplementary nutrition. This is only for an example I am taking. A child may be even 18 kg. So this is an example. See, from our ICDS, we saw. So children between 6 years, they need 500 kilocalories, 12 to 15 grams of protein. So severely malnourished children, 800 kilocalories, 20 to 25 grams of protein. Pregnant and nursing, 600 kilocalories and 18 to 20 grams of protein. Although we cannot deal directly, but it is indirectly tells you there is 1/3 of calories and half of the protein requirement. How many visits does an ASHA worker make for home-based care of the young children in home delivery? See, in case of an institutional delivery, when a delivery occurs in a hospital, the ASHA will make 6 visits. What are the 6 visits? She will make visits on day 3, 7, 14, 21, 28, and 42. Then, in case of here, what is this? They are asking home delivery. Now, the delivery has occurred in the home. So, here will be 1 additional visits. So, it will be 7 visits. So, just you have to add only the day 1. Day 1, 3, 7, 14, 21, 28, and 42. And in case of a cesarean section, see, the mother will already be in the hospital till around maybe 5 days. She may be in the hospital till around 5 days now. She may be in the hospital only till around 5 days. Only in the 5th day she will be discharged. So 7, 14, 21, 28, 42. It is only 5 visits. So this 5 visits. Next. Undernutrition is due to decreased intake and poor absorption of vitamins and minerals. See, poor absorption of vitamins and minerals, it is mainly refers to micronutrient deficiency. This is an iceberg phenomenon because many of them they do not know. Only we are seeing few children with vitamin A deficiency, with night blindness or white hot spot. Many of them we do not know what is happening. So it is an iceberg phenomenon. So it is less obvious. So only it is being called as a hidden hunger. So only it is called as the hidden hunger. Next, the world's first quarantine was implemented for which of the following diseases? See, for the disease plague, there was a plague epidemic in the 1300s. There was a plague epidemic in the 1300s. During this epidemic, only they learned about the introduction of quarantine. So slowly learning from this epidemic, they introduced quarantine. So what is quarantine? What is isolation? So we discussed about this in the workbook. So quarantine, we are only separating the people who are apparently normal. They are apparently looking normal, younger, they are cuter. But what? Although they are cuter, but the problem is what is they are exposed to the agent. So they may be in incubation. So they may develop the disease anytime. So we have to separate them for the longest incubation period of the disease. So they are looking normal. So the blood test or the test, specific diagnostic test, or it may be negative now, but they may develop the disease in the future. What is isolation? This is diseased people. We have diseased people. In order to prevent them from spreading the disease to others, we are separating them. Period of communicability. For how much time we will separate them? We will separate them for the period of the communicability of the disease. First, plague. So you can learn about this mainly in an article. There is an article called Lessons from the History of Quarantine. In this article, you can learn about this. Lessons from the history of quarantine, from plague to influenza A. You can learn about this historical things more in this article. Next, door-to-door vaccination in areas where wild poliovirus is still present. It is called as mop-up vaccination. So what do they do in the pulse polio? So in the pulse polio program, what do? They set up the booths So what is this? The children who are going for routine vaccination, in addition to the routine vaccination, the children all over the world they come. They are all over the world they come. The books, irrespective of the previous dose, they take it. So irrespective of the previous dose, they take this dose. Then, if any children are left out, what they will do? So in this pulse polio immunization program, if any children are left out, they will do house-to-house search, door-to-door. So usually how they will find out? Because in the child, they will put some mark in the child, like they will put a mark. Then the child is vaccinated. Then they will go search the house-to-house. In the house, they will call the parents and the child. In case the parents are refusing, they are not putting, then they will put up mark, X mark in the house. This is the house, they will put a X mark in the house. So by this, during the next visit, at least they can convince and try to the child. So door to door, there is a mop-up vaccination. Nice. Thank you. If you see, out of 17 questions, 13 questions it came from our related content. 4 questions are from the extended content of the book. So extended content which we could not discuss due to time constraints. So almost for 10 questions, the answers were directly from the workbook. So 10 questions directly from the workbook. Students, thank you. All the best. See you again. If there are any controversies relating these questions, you can put in the comments or reach me. We will try to clarify. This is only based on the recall, so there may be some mistakes, maybe in the questions like the words, so you can try to reach me. Thank you. Thank you.